Welcome to Group 2's presentation, where we looked at venous thromboembolism, specifically deep vein thrombosis, and a complication called pulmonary embolism. Sims defined deep vein thrombosis. Rajna Sinclair listed the cause and risk factors. Tiandra Sims did the pathophysiology. Princess Powell did the diagnostic evaluation as well as the medical management. Dale Rochester Powell, Cherise Brown, and Rajna Sinclair did the nursing management, health promotions, and possible complications.
Is it worth it after all, child? It'll be worth it after all. Woo! Jesus! Why? Why? Pebbles! Pebbles! Come here! Quick! The foot, yeah, Pebbles. The foot. Me say a piece of pain in my foot. The pain, the heat, Almighty God, the swelling. Me tell you, say, you see, for me come back from England, the foot here kill me. I no rest with the foot. Me tell you, I know me always have foot problem, So you see, when me go to England for the 9-hour flight, me take every precaution. Me say me no get up on the foot, not even bathroom. Me no go. Me rest me foot because me say me nah hackle me foot them. And me say from me come back, see there, I saw it swell. It swell and me tell you see a piece of burning in a heat. The heat like heat get where in a heat, man, and the pain that kill me unbearable. And me say listen, nobody can help me say I know the neighbor them over there so do it, them the old Judas, them the old Jezebel, grandma. Them give me food. No, listen, hear me out. Me tell you say one before day, me see them get up very, very early, the husband and the wife. And they get up very early. We don't think them are going nothing more than up your man then go. Grandma, me say me a set back the blue up. Me a set it back.
Grandma, stop your foolishness. What kind of obby you talking about? Listen,
I know I said in bad mind already.
Listen, this pain that you have in your leg, it is unbearable. Alright? You said it's unbearable, so I need to get you to the hospital, alright?
I can't.
I am going to call the ambulance. I am going to call the ambulance for them to come for you and we carry you to the hospital, alright?
Come.
Hi,
Hello.
my name is Dr. Sims, and this is...
Intern Powell.
What is your name?
Dale Rochester Powell.
Okay, Mrs. Paul, not that I'm doubting what you're saying, but I'd like to check on your armband. Is that okay with you?
Sure.
Okay, Dale Rochester Powell.
And do you know where you are, Mrs. Powell?
Yes, of course. Me in the hospital. For me, my granddaughter take me to the hospital with the foot.
That's right. You're at La Vista Memorial Hospital. Alright.
Alright, so you came in complaining of pain in your right leg, which according to May 2022, it is one of the major signs of deep vein thrombosis. You came in with pain, swelling, heat in the foot, yes, the arrhythmia, and we realized upon assessment that you have pitting edema. So this is when we touch the skin and there is a pitting in the skin. So we realized that there was that type of swelling, and we also realized that there were some redness in the leg. And so these 4 signs, these are signs of deep vein thrombosis according to May 2022. So in order to confirm or deny that you're having a deep vein thrombosis, we will need to complete some tests. So the tests that we will be educating you on, some of the tests that will be done, that can be done, and we also will be doing one of the tests. This is the duplex ultrasonography, and this is where you use a handheld device and you run it across the leg, and we can see how the blood is flowing within the vein. And so with us seeing how the blood is flowing in the vein, we will be able to see if there's any occlusion or if there's any clot within the vein.
We also have a contrast venography that we could do. This is where, and that's an x-ray, this is where we'll inject some special dye into the bloodstream, and then that will show if we have any occlusion again in the veins.
Okay.
We can also do MRI and CT scans, and this is where we use the radio waves or magnetic field to see the imaging again of the area and the veins.
Okay.
We could also do a CTPA, that's a pulmonary angiograph, where again we'll use some special dyes and we'll see if there's any clot in the lung. Because DVT can lead to pulmonary embolism, and is when the clot gets dislodged from the leg and travels up to the lung.
Deep who you say me might have?
Deep vein thrombosis, a blood clot within the vein.
Okay.
And this is usually the extremities like the leg, in this case.
Yes, so we want to order you to do the duplex ultrasonography. That is the least invasive procedure, and it is one of the hallmark tests, and this is according to CDC 2024. So we'd like to get your signature if you agree in doing this test
How
tomorrow.
soon?
Today. Yes, and you get the results by tomorrow.
Okay, no problem, doctor.
So can you sign right here for me, please?
Yes, please. Let me read it. Okay, no problem.
Alright, so the nurse will carry you to complete the test today, and you'll get the results by tomorrow.
Okay, okay. Let me go call my granddaughter and tell her what go on with me and all.
Okay, alright.
Alright, thanks.
5 hours later.
Come.
Hi again.
Hello.
So,
I hope you have good news to me today.
unfortunately, it has been confirmed that you have a blood clot within your vein
Jesus, look down.
called deep vein thrombosis, and it's a part of the big heading venous thromboembolism. So from you hear the word venous thromboembolism, you hear vein, and the thromboembolism would be blood clot. So you have two conditions under this broad heading according to CDC 2024. You have DVT and PE, DVT, deep vein thrombosis, and pulmonary embolism. So now, right now, it has been confirmed that you have deep vein thrombosis. And deep vein thrombosis is where you have a blood clot within the vein. So it has not gone to the lungs, or it has not gone anywhere. It is still in your leg within one of the veins, right? So a complication now of the deep vein thrombosis would be pulmonary embolism, and this is where you have a breakage of the blood clot, and it breaks off and it travels up to the right side of the heart, and it goes through the pulmonary artery, and then it goes into the lungs. It can be fatal,
That's all like you can kill me, doctor.
but it does not have to be fatal. It can be, but it doesn't have to be fatal. Do you have any questions?
Lord, I have a whole heap run through my head. Did I sound that never dead, so?
No, man. Dr.
Medical
Cole will
management.
be managing your care throughout your stay at the hospital. But before that, I'm going to be showing you some picture just to concretize, just to show you what it really is.
So, according to Stone et al. 2017, blood clots are usually formed in the cusp of the valve. So we know that valves are in the veins, and valves are there to prevent the backflow of blood. So when you have stasis in the blood, or the blood is slowed down, blood clots are prone to be formed. So now, because the blood is not flowing as it should, the blood will start to pool within the cusp of the valve, and this will create a character, a right environment for the blood clot to begin to form. So now, in this environment, certain proteins that help to prevent clotting, protein C and S, they are reduced, while others that promote clotting are increased, such as the P-selectin, and this helps to attract a substance called tissue factor to the lining of the blood vessel. And tissue factor is the main instigator of blood clot within the veins, and the fibrin will hold the blood clot together. So blood clots are usually formed in area where there is slow or blocked blood flow, particularly near the cusp of the valve, in the extremities, the lower extremities of the leg. It can happen in your pelvis and hip, but it usually occurs in your legs, and it can also happen in your upper extremities as well, but as stated, it is usually happening in your lower extremities. After the blood clot is formed, piece of the blood clot can be broken off, and it travels to the right side of the heart and goes through the pulmonary artery and then to the lungs, which can be fatal.
Mrs. Powell, I must commend you for keeping your leg elevated. Now, Dr. Powell will be educating you on how we'll be treating your DVT.
Okay. Alright, so this is a severe case of DVT, and I'm going to be guided by Thelma 2020 on how we will treat you. First thing I will be doing in this case is to give you some thrombolytics. Those will help to break up the existing clots, right? And then I'm going to give you some anticoagulants. I'm going to give you injection and oral anticoagulants. The injection is called heparin, and the oral one is warfarin. Heparin will work immediately, while warfarin might take 3 days to take its therapeutic effect. And after leaving the hospital, and long term, we might have to keep you on aspirin, which is a blood thinner, to prevent more clots.
Yes.
All right. Then we have a surgery that we can do. It's called mechanical thrombodectomy. And it's where we'll go in with a catheter and take out the clots, right? We also have an inferior vena cava filter, which is a device, a small device, that will go into the vein and prevent clots from going into the lung. All right. We also have compression socks. We'll ask you to wear compression socks, and that is to prevent swelling and to prevent ulcers from forming
And reduce the pain.
and reduce the pain.
Now you can wear this for about 2 years. You should wear it after we administer the pharmacological treatment.
Okay.
All right, and it also helps to prevent post-thrombolytic syndrome. All right.
Yes, thank you.
All right, Mrs. Powell.
So we're going to order the medications now, and then nurse is going to come and administer them. Okay?
Yes, thanks for everything. Thank you. Come.
Hi, hello. I am Nurse Sinclair, and you are.
Dinner Chester Powell, ma'am.
Alright, Miss Powell, I'm just going to look at your armband for verification as it is protocol for me. Alright. How are you feeling today, Miss Powell?
Yes, so good at all. No, I really feel no pain now.
Alright, good. Doctor has informed me about the condition already, DVT, right?
Yes, yes.
Alright, so I'm just going to give you a little bit more information on the condition, DVT, deep vein thrombosis, and I am guided by Mayo Clinic 2022. Alright, so I'm going to inform you on the causes and the risk factors. So for the causes, we have the varicose triad, which includes blood stasis, and this is due to prolonged immobility, like you're laying in this position for a long period of time, no turning, no elevating of foot, so that leads to blood the blood pooling up, right? And platelets they coagulate and lead to DVT, right?
Yes, famous. I did take one long flight to England, 9 hours, and I never moved not 1 minute.
No,
At the same place.
You must move up. Anytime you get the chance to move, you move, alright? Alright, now we also have the endothelial injury, and this is damage to the inner lining of the vein, and also we have hypercoagulability, right? Coagulation, hypercoagulation, and this is due to conditions that causes blood to be clotting more, like your genetics, like the factor V, and also like acquired conditions like cancers, right? Now I'm just going to inform you on the risk factors. Risk factors include your immobility. So as I have stated before, immobility, if you're sitting in this position for too long, like your 9-hour flight to England, that definitely can cause DVT, right? Also, hormonal therapy. So if you're on birth control for a long period of time, it can definitely
20 years now, me top take that.
all right. And also like surgeries and traumas. So
This one with the
especially
surgery too, you know, about 3 months ago on the foot, the said foot.
so especially if you had it done in this area, it definitely can cause it, right? So you said they have the surgery here, right? All right. And also we have the genetic disorder, as I mentioned before, the factor V. Also chronic conditions like obesity. So when you're overweight, that's definitely a factor to cause DVT, right? And other factors like smoking, your age. You have a previous history of smoking, right?
But nobody report that. Me take that long time.
All right, Miss Rochester Powell.
Okay, so our patient in room 2 is suffering from a case of deep vein thrombosis, and we are now tasked to create 3 nursing diagnoses, and we need to provide interventions for each and also the rationale.
Alright.
Now, what are your thoughts? What could be the first intervention?
Alright, so we could have acute pain. So this is a nursing diagnosis. So we could have acute pain related to inflammation and swelling in the affected limb, evidenced by patient verbalization of pain, tenderness and discomfort in the affected area, and this is by Ackley and Langwith 2023.
Okay.
Alright, so my nursing intervention and rationale for acute pain. So firstly, we could administer prescribed anesthetic as needed. So we know that pain reliever is crucial for patient comfort and can help reduce inflammation, and this is from Venous et al. 2019.
Yes.
We could also apply cold compression to the affected area. Alright, so cold application can reduce swelling and numb the area, providing pain relief, and this is also from Venous et al. 2019. We can also elevate the affected limb above heart level.
Yes.
So this elevation helps to reduce the swelling by promoting venous return, and this is from Venous et al. 2019.
Okay.
We can also encourage the client to rest and limit movement in the affected limb. So rest helps to reduce inflammation and pain associated with movement, and this is from Venous et al. 2019. We could also monitor the pain level using a standardized pain scale. So we all know that regular pain assessment helps to evaluate the effectiveness of the pain management strategies and adjust care as needed, and this is also from Venous et al. 2019.
Okay, good. So we need one more diagnosis.
Alright, the next diagnosis that we can have for our DVT patient is ineffective peripheral tissue perfusion related to venous obstruction due to thrombosis, as evidenced by decreased blood flow, swelling, pain, and changes in the skin color and temperature. Ackley and Lewis 2020.
That's the reference.
Right.
Okay.
And some interventions that we have and rational for the patient. We could administer anticoagulant therapy as prescribed, and anticoagulants help to further clot formation and improve blood flow, prevent further clot formation and improve blood flow.
Okay.
And we can also encourage frequent repositioning and range of motion exercises, as these activities promote circulation and prevent stasis, right? We can also monitor and document peripheral pulses and capillary refill regularly, and assessing pulses and capillary refill helps to detect changes in the perfusion status, right?
What's your reference?
And Venous et al. 2019. Educate the patient about avoiding prolonged immobility and leg crossing. These actions can exacerbate venous stasis and impede blood flow, right? And you can also apply gradual compression stocking if prescribed. And we know that compression stockings help improve venous return and reduce swelling.
Right.
So all my references right is from Dogmees et al. 2019.
Alright, good. Now, for the last diagnosis, I'm thinking about impaired physical mobility related to pain and discomfort in the affected limb.
Okay.
Reduced muscle strength as evidenced by difficulty in ambulation or performing activities of daily living due to the swelling and pain. And this is referenced by Ackley and Lagwig 2023.
Okay.
Alright, now I'll be looking at the interventions. Alright, so I would start off with encourage the use of assistive devices. These are like crutches, your walkers, as needed. The rationale, assistive devices help reduce weight bearing on the affected limb, facilitating mobility, and this is by Dogmees et al. 2019. Also, I would provide pain management before physical activity or physical therapy sessions. Rationale, this effective pain control can enhance participation in mobility exercises, and that is referenced by Dogmees et al. 2019. I will also implement a progressive ambulation plan as tolerated. The rationale, gradual increase in activity helps improve strength and mobility without causing excessive discomfort, and that's by Dogmees et al. 2019. What I would also do is teach the patient and family about safe mobility techniques and environmental modifications. So when you educate, education promotes safety and prevents falls and further injury. Also referenced by Dogmees et al. 2019. I would also do a collaborate with physical therapy for a tailored exercise program. Rationale, physical therapy provides specialized exercises to improve strength, flexibility, and mobility. And this is also by Dogmees et al. 2019. So now that we've had the 3 diagnoses, nursing diagnoses, and we have all our interventions, we have all our rationals, so now we can go forward and provide the best possible care for this patient. Okay, nurse, I've been thinking about the patient in room 2, patient in Chester Powell, who is suffering from deep vein thrombosis. Now, there are several complications that are affiliated to this condition. You have pulmonary embolism.
Yes.
Right? You have chronic venous insufficiency.
Yes.
And you also have post-thrombolytic syndrome, and all of these can be fatal. Pulmonary embolism, this is when part of the clot breaks off, travel through the veins, and enter the lungs.
Alright, and chronic insufficiency venous, it occurs when the blood stays in the vein instead of flowing to the heart, which causes pain and swelling. Thrombolytic syndrome, this occurs after a deep vein thrombosis is in the leg. It also causes pain, swelling as well. It can also lead to ulcers if not treated at an early stage. And all of these complications, it hinder our patient from doing daily activities and walking.
Health promotions according to Mayo Clinic 2022. Stay active, avoid prolonged bed rest, long sitting periods, and also perform leg exercises during long trips and recovery periods.
Maintain a healthy weight, stay hydrated, quit smoking, and avoid excess alcohol consumption.
Teach patients about the signs of DVT, such as pain and tenderness in the leg, especially the calf, swelling, redness, discoloration of the skin, and warmth in the affected area.
This is the end of Group 2's presentation, where we looked at venous thromboembolism, specifically deep vein thrombosis, and a complication called pulmonary embolism. We hope that you learned something about the condition. Know the signs, save a life.